May Finlay. I'm a Yorta Yorta woman, and I'm here at the International Indigenous Health and Wellbeing Conference that's run by Lowitja, and I've said that so many times it just didn't come out. And I'm here with James Smith from Menzies. James did a workshop this morning. Do you want to tell us a bit about yourself?
Yeah, so I'm a Father Frank Flynn Fellow at Menzies School of Health Research.
Say that 3 times fast.
Yeah, Father Frank Flynn Fellow, it's a, a hard one. Generally speaking, doing alcohol and other drugs research. But we've also been doing a piece of research around health literacy and young Aboriginal and Torres Strait Islander males in the Northern Territory.
Okay.
And as part of that, we ran a workshop this morning around building an evidence base around what works and importantly also what doesn't work with young Aboriginal and Torres Strait Islander males. So we heard from a few different projects, one that's run by Uncle and Dr Mick Adams, one that's run by Kutsi Canuto, and one that we've been running around the health literacy work. And then we had a bit of a yarn with some of the participants here at the conference around what's working in their communities and strategies for building more research and evaluation relating to young Aboriginal and Torres Strait Islander males.
Fantastic. So, I mean, why specifically young Aboriginal males?
So we know that they're often looked at as a high risk and vulnerable group, that they do engage in risk-taking behaviours, but part of the research that we've been doing is looking at, well, what can we do to engage this particular cohort better? And what we found through certainly the health literacy research is that they are a group that are thinking a lot about their health and wellbeing, and that relates to both navigating Western health systems, but also understanding the importance of cultural ties to health as well as part of that. We've also found that, as you would expect, that family is incredibly important to them. The notion of love and respect has oozed through the yarning sessions we've done with those young fellas. And we also did an interesting thing where we looked at some of their Facebook feeds with their consent. To see what they were saying around their health and wellbeing and to see whether that measured up with what they said in the yarning sessions.
That's fantastic.
So we've got some beautiful images that they've been posting of their family, of being on country, of things that are important to them around their health and wellbeing that's included in that research report.
Fantastic. Is it finished yet?
It is. We've just finished it last week in the lead up for the conference. It hasn't been released, but we do have some hard copies of the report here at the conference, and it should go up on the web in the next couple of days.
Fantastic. And can you make sure you send it to me, because I will tweet that out, because you can tweet it out too. But
that would be great.
We'll share it. Is there anything you would like to say to young men, given that you've done a lot of work with them?
Well, listen, what we're hearing from young men themselves is that they are interested in their health. And that they are interested in help seeking, but they don't always know where to go to for that help. A lot of it's done informally. They go to coaches, to teachers or family members, not necessarily to health services in the first instance. So there's probably some more work to be done in bridging that gap between help seeking and health service use. So the one message I would say is access those health services, and for health services to reach out to men. Think about outreach models that engage these young men in the places that they are and meet them on their terms.
Awesome. Is there anything else you'd like to add before we sign off?
No, just that the conference seems to be awesome. Lots of people here, lots of excitement. So looking forward to a week of learning.
Fantastic. And hopefully we have some, I'm working with James on a new project, and hopefully at another conference in 2 years we might have something to present.
Hopefully.
Thank you.